and with this, and definitely talking more about Europe being fragmented. And well, we'll hear about how we can go or work towards the European Union from Professor Mathias who's my esteemed colleague. And I'm very happy that yesterday you already had the chance to meet him and to listen to his impressive knowledge. Professor Mathias he holds a PhD in economics from Harvard University, and he has been since 1990 a professor in economics at ULB. He has been in between 1998 and 2011 a visiting professor also at MIT, and he has been the research director of the CEPR. He's also, as you heard yesterday, an honorary vice governor of the National Bank of Belgium, where he served between 2011 and 2017. He has published and did research in areas of contract theory, organization economics, innovation, and banking and finance. And of course, as you heard yesterday as well, he has been involved very actively advising the ministry or Minister Sophie Wilmès, this is what I wanted to say, and the Ministry of Health. At this time during the COVID pandemic in the G's and GEMS. And actually, also, he recently lectured sharing his thoughts on the Draghi report to President Macron. So he is actually talking to the big guys out there. So we're very happy, Matthias, that you're here, that you are willing to share your knowledge and stipulate some of the points you already alluded to yesterday and explain to the students how you see we can work towards a European Health Union.
Well, many thanks, Hilda. It's great to be part of this great program today. Very happy to share my knowledge. The question is, how do I share my slides? So I push on
I think you have a green button, green box with share or partager or delen, with an arrow up, and there you can select your screen where your slides are open.
Now the question is, when I do this is what happens. And because, oops, where are the, just a second.
Do you have your slides open? Otherwise, I can maybe ask.
Well, if somebody could help,
Caroline, can you?
Yes.
that would be great.
Then you stop sharing, and Caroline will share your.
Yeah, then I will share your slides, Mathias. Okay.
Great. Thank you. Sorry for being.
No worries.
My son-in-law says I'm electronic. There is illiterate and electronic. So sorry about that. And I know Michael Castañeda jokes with me about this, and thank God he's not here today, but George can tell him. So does that mean I will ask to move to the next slide then, or can I do it myself?
No, you need to.
I will have to do it then.
Okay, my apologies, Caroline.
Don't worry.
Since you've done already so much yesterday, sorry to impose this on you today.
Don't
Anyway, it
worry.
was great yesterday. I don't know how many in the audience were there yesterday, but in a sense, with the first question that Vanessa asked me on the panel, in a sense, I gave a very condensed answer about which is a summary of this. But so at some level, so I think hopefully what I said yesterday will become clearer today for those who were a bit confused. So the topic I've been given is indeed towards a European Health Union recommendation to increase Europe's competitiveness, and that's of course about the Draghi report. And as I said yesterday, maybe we can move to the next slide. and then the slide afterwards. So the Draghi report is saying that Europe is facing this problem of getting poorer than the US. And by poorer, we mean per capita. So we typically use the term as economists GDP per capita, which is basically income. And of course, it's not a perfect measure, but as we know, it's not because it's not perfect that it's uninformative. And so we all think that especially with the current aging and all this, we need enough income to be able to redistribute it, and in particular, to redistribute it to pensions and to healthcare. And this is completely uncontroversial, from 45 to 75, Western Europe caught up with the US in terms of GDP per capita. We could joke a bit about the key to our success was to start low because we had destroyed everything, and so indeed you can catch up. Then it kind of stopped, and as I said yesterday, some people say it's not the end of the world. We are only 75 to 80% of US GDP per capita, but they work like dogs. We enjoy life, and that's okay. Unfortunately, in the last 30 years, the US has grown twice as fast than Europe per capita, and thanks to productivity growth. Basically, there was the IT revolution, and as we know today, all the big IT firms, the GAFAMs, well, they're all in the US. And I think that's a very big part about the Draghi report. Unclear what we can do at this point because we are so far behind, even though the Chinese did catch up. And the big IT firms that are not Americans are typically in China. Now there are economic theories about why this has happened, and in particular Philippe Aghion with Peter Howitt. Hopefully soon they will get a Nobel Prize for this, looking at the growth through innovation. They distinguish between catch-up growth, where you just imitate what others are doing. And indeed, after World War II, there was the Marshall Plan. We could use a lot of energy. We had good educational system. And so we could catch up. That explains the phase 45-75. Now, today, since the mid-90s, as I said, the US has managed to take advantage of the IT revolution, so the Silicon Valley miracle and so on, and now the artificial intelligence revolution. And the key is that these technologies are called all-purpose technologies. They end up being applied to many, many things. For example, the IT revolution, some people are saying, look, what Elon Musk, who's an awful person, politically speaking, what he has understood is that cars are basically computers on wheels. Just like Apple had understood at the time where Nokia was ruling the world. I don't know if you remember that, the 3310 portable phone. Well, the iPhone is basically a computer. And the problem is that this may come and is coming to pharma. So we have to think about this, but because we are starting with a big handicap there. The point of the Draghi report is that Europe has failed to put in place the institutions and policies that promote disruptive and or radical innovation. So maybe next slide. Now, why is that? Well, first of all, and there is also evidence beyond the Draghi report on this, is that our firms don't put enough research and development. They only spend half of what is spent in the US in the private sector. And that's due to the fact that different sectors have very different sectors. The different economies, different countries have different sectors, and the different sectors are differently R&D intensive. And in particular, Europe is stuck too much in what is called mid-tech, and in particular, the auto industry, which currently takes more than 50% of R&D in Europe. In the US, 85% is in biotech, software, hardware, and artificial intelligence that are very R&D intensive. So that's problem number one, and the next slide will show some numbers of that. But before we go to the next slide, or maybe, okay, we can go to the next slide. Thank you. And then we will come back. As you see, I think these numbers are frightening, frankly. The top private R&D spenders in the EU and the US. In 2003, and so I'm not talking about the very long run. Here, 2003 is only 22 years ago. In the US, you had Ford, GM, General Motors, so auto industry, and Pfizer. Now, EU, it was Volkswagen, Mercedes-Benz, so car industry also, and Siemens Electronics. So, okay, we weren't that different. But look at 2012 and 2022. Well, and you see, it's not a story about pharma, even though Merck was in the top three in 2012 in the US. The rest was basically hardware and especially software and IT. And of course, Alphabet is Google, Meta was Facebook, and Microsoft. So while in the EU, unfortunately, it remains auto. And by the way, it's even worse than that because Tesla is not European in the US. And the biggest competitors of Tesla are Chinese electric car companies. And even on non-electric, Toyota is worth alone, I think, almost the whole European car industry. So, but let's come back to the previous slide. So we have that problem, and I won't talk, of course, about the problem of car industry. And until now, as you see, the big deficit is in Silicon Valley type firms, and the excess, in a sense, but it's a sector in trouble, is in cars. So now, but some of the problems are also affecting all sectors, and that's, of course, the fragmentation. We have 27 labor laws. We have national procurement rules, so much less centralized than in the US. We have 27 securities regulators, so for shares and firm debt. We have 27 electricity, pharma regulators, even though things are, of course, a bit complicated. We'll come back to that. We do have EMA, so that's not that's already centralized, but not everything is. We have no true capital market union. Yesterday, there was a lot of discussion about as an entrepreneur in the US, you can go to much bigger venture capitalists and all that. You have even a stock exchange, which is fully looking at new technologies, so NASDAQ. You also have in the US private pension funds, private mutual funds that invest in a number of things that then take risk and finance radical innovation. Now, of course, there are lots of things we don't like in the US. I wouldn't like to live there, especially if I don't have a very good job and I have a big health problem. So I won't be taken care of. But on the other hand, since we are talking about innovation and productivity increase, you cannot ignore the fact that there is attraction in being able to go to a big market like in the US. And it was said by George that the world pharma market, half of it is the US. That's partly because their consumers and the state through Medicare pay too much. But this is life. We live in that connected world. So maybe we can go then to the following slide from this one. So that's private sector and regulation, all that. On top of that, the Draghi report says, look, the European public sector to innovation is also problematic, too national, but also insufficiently focused on disruptive innovation, with often the wrong method to allocate the funds. In the US, and we'll come back to that, they have these RPAS and including BARDA that does it very well. In the US, so funding is concentrated at the federal level, so you can have scale economies, and indeed, pharma is is a world market. While EU funding happens mostly at member state level, and that's, I like to say, and I said it yesterday, the EU is a regulatory giant. More than 50% of regulation, of all problems come from the EU, but the EU budget is only 1% of EU GDP. Most of the budgets are at national level. And for things like research, where you have a lot of what economists call scale economies, where it's important to concentrate, that's a big problem. It's a huge handicap as the key global challenges are concerned, like the green transition, the digital transition, and some problems of healthcare. So next slide. As I said, on top of that, DG Research is not resembling the ARPAs, Advanced Research Project Agencies, which allow the American government, or rather the top scientists to whom decision-making and project management are delegated, to stimulate disruptive innovation in strategic sectors. So people talk a lot about the defense ARPA, which is credited for having been really important at developing GPS, and also as having pushed the internet. So even though there was, at CERN in Switzerland, there were key developments there too, but the US made it much more user-friendly. In France, at some point, there's something called the Minitel, which is a bit the same, but it didn't win. Scale matters. So these things, it's important, and I'll come back to this in explaining how it works in pharma. So maybe next slide. So what does the Draghi report recommend in general? A massive public and private investment in fundamental research and disruptive technologies, supported by reforms to EU governance, aimed at streamlining decision-making, limiting the multiplicity of regulatory constraints, and putting the scientists and entrepreneurs in charge to allow for the emergence of promising new innovators. Now, some people have criticized the Draghi report for being right-wing, because saying, you have to deregulate and let the market work. Now, I've heard Draghi in Paris saying, no, that's what Mariano is saying. What we are saying is that for a number of things, you should replace 27 regulators at national level by one EU regulator. It doesn't mean the EU regulator should dismantle the regulation. It should simplify. And it's a different thing should you have more or less strict regulation. But here there is a lot of unnecessary complexity. So next slide. Let's focus now on pharma per se. And next slide. So as I said very quickly, and Vanessa already said part of that yesterday, the good news is that pharma is not big tech. We exist in pharma. Now, pharma is, of course, as you know, a big sector, the fourth largest in terms of net sales in the world, and the third largest in overall profit, as Georges said, it is a profitable sector. And in the EU, it's a significant contributor to the EU's economy. 5% of the value added, so the revenue to the economy from all manufacturing, employing almost 1 million people in last quarter of 2023, up from 680,000 people 15 years before. So it's a big employer and a growing source of employment, and these are good jobs, high-paying jobs. So it's important to remain strong here. And by the way, the reason why it employs so many people is because most of what we consume in Europe is produced in Europe, or at least the balance, we do import some stuff, but we also export. And in this sense, when we talk about high quality drugs, so patented drugs, they are produced, what we consume is produced in Europe. Now, of course, generics, it's not the case, but that's the typical offshoring due to globalization. If it's much cheaper to produce them in low-wage countries and it's okay to have quality, we've done that. Now, we've done that a bit too much. And there are these debates about, indeed, the geostrategic autonomy and so on. The COVID-19 pandemic showed that, if I produce the stuff, I will give priority to my own population, naturally. So there is the issue of, there is this view that we went with globalization to a just-in-time system where you produce where it's cheapest and then you organize supply chain. But now with COVID, we understood that it's not just in time, it's also just in case. In case of a crisis, and by the way, there are health crises, but they can also be geopolitical crises. And when you look at Mr. Trump, for example, allies can become, I wouldn't say enemies yet, but okay, let's say strange people. So you may want to indeed develop strategic supplies of standard products. Now, let's not dream, huh? If we do that, the cost will be higher because you need your own workers to be ready to work on this, huh? And they won't work at the Indian wages. So in that sense, it's a political issue. It's not what the Draghi report is about, because these kind of specific things won't change the overall picture of productivity. Here, what we are talking about, how do we keep innovating? And as I say, we are currently strong, but there are some worrying trends, as the next slide will show. So, as I said, strong positive net export, strong manufacturing base, for medicines under patent, strong publication. So our universities are doing well, and what Trump is going to do if he keeps going against top US universities, I think we may take advantage of that with people leaving the US and coming to us. But we are falling behind in the most dynamic segments of the market. So in the last 10 years, well, 2012 to 2022, the total market for drugs had increased by 50%. But biologicals, it was plus 150%. So multiplied by, 2.5. So from 100 to 250. And for orphan medicines, where the market has exploded for all the reasons that George has explained, the market has been multiplied by 24. And for these advanced therapy medicinal products based on genes, tissues, and cells, we are also falling behind. So for the most innovative stuff, we are fragile. And so in that sense, Draghi says, look, and by the way, the report, which is available publicly, if you read chapter 19, it's done very well. It's only 20 pages, and it explains all this. If you're not convinced by these by this summary, and even if you are convinced, please go and see it. So next slide. So why are we at the risk of falling behind for the most innovative stuff? And that's, by the way, on top of the AI challenge. If AI takes over healthcare innovation, given that the GAFAMs are great compared to what we have or we don't have in the EU, that's an additional problem. But let's even forget about that problem. There are things we can do. And what Draghi is saying, look, we are lower on total R&D investment. We have fragmented public R&D. Max Planck is good, but it's German. INSERM is good, but it's French. And when you look at Belgium, VIB is very good, but it's Flemish. We have lesser private R&D investment in the EU, and in particular, that's linked to our financial markets. Our system is too bank-oriented and not enough equity and public equity and private equity oriented. And we have a weaker supporting environment. There are bigger hubs in the US and increasingly in China. So in Cambridge, Massachusetts, in San Francisco, they have bigger places. China is also concentrating. It's again a single market for 1.3 or 4 billion people. We have a slow and complex EU regulatory framework. It's very good EMA for authorization, but we have national health technology assessment, and of course, pricing and reimbursement are national. But there is a difference, and the Draghi report makes a difference. It would be much easier to go to a EU HTA than to start having pricing and reimbursement that would be EU-wide. Let's forget about reimbursement because it's a political decision. But pricing, I'll come back to this at the end. And also, we have, and it was alluded to yesterday, we should push for European health data space, and we don't have that yet. Next slide. So the report acknowledges recent EU regulatory progress in trying to fasten authorization of new medicines, facilitating clinical trials and use of data, and coordinating health technology assessment work. Still, it recommends going further in these various directions, in particular going towards an EU HTA agency. And it recommends increased and focused public R&D investment in the EU. IHI, former IMI, is part of the solution there. We discussed that at length yesterday. But we should try and concentrate, support a number of world-class innovation hubs in life sciences for advanced therapy medicinal products. So this is what the Draghi report is suggesting. And now I think, next slide. Let me briefly explain how the lessons of the COVID-19 vaccine episode adds light to the Draghi report. So here, until now, I discussed and commented a bit the Draghi report. Now I'll focus on work we had done at I3H. All the references are at the end, and you're of course very welcome to dig into that if you're interested. So next slide. Now, successful vaccination requires a number of steps, and here I will focus on steps 1 and 4, R&D and purchases. So you first, to get a vaccine, to do R&D, you have to authorize it, you have to produce it, you have to purchase it, and then you have to deliver, to have a delivery system and people willing to be vaccinated. As people say, vaccines don't save lives, vaccination does. So you need to get the vaccine into the arm of the people. So as I say, on this talk, I will only focus on 1 and 4. Especially, I only have we started a bit late, but let me not exaggerate. I see I have another 11 or 12 minutes. So next slide. On R&D, I must say, for COVID vaccine, the US has been the clear leader. And I mentioned a paper we wrote with Michel Goldman, Philippe Aguillon, and Sofia Amaral Garcia, a short paper already in September, beginning of September 2020. Okay, the US has a great system, research university, the NIH, biotechs, good financial markets, big pharma, and all that. But the key was the ability to centralize and to use BARDA, which is now ARPA Health, Biomedical Applied Research and Development Authority. Then they had Operation Warp Speed and so on. They even used the US Army, and that was under Trump. But Trump was less crazy in 2020, at least on this one. Of course, he recommended bleach and stuff like that, so he was crazy also. But here, he didn't micromanage the stuff, and it was impressive. How impressive? Next slide. Um, Basically, doing what the Draghi report recommends. So concentrate the funding and give some autonomy to scientists and entrepreneurs. So basically, they selected, as I said yesterday, 6 projects and gave a lot of money. So at least 1.2 billion, that was to Oxford AstraZeneca, up to 248 billion to Moderna. And they were pretty smart. They diversified the risk in the sense that they said, okay, we'll concentrate the funding on 3 technologies because we don't know what will win. And we choose 2 firms per technology. So, and interestingly, each time the firm, one firm was US and the other was European. So who got money for mRNA technology? Well, BioNTech, as I said yesterday, it was not Pfizer who got the money. Pfizer came later to this for the production side. So almost 2 billion to BioNTech, a German biotech company, and 2.5 to Moderna, a US biotech company. Then that was the most innovative technology. Then viral vector, Johnson & Johnson, US, and Oxford AstraZeneca, Oxford University teaming up with AstraZeneca, UK and Sweden. And protein subunit, a third technology, Novavax, a US biotech firm, and Sanofi GSK, a duo of top vaccine producers, France and UK. And next slide. It was a wonderful success. It was almost too good to be true. All 6 have been authorized by the FDA in the EU, in the US, and or EMA in the EU. In fact, interestingly, Sanofi GSK was the last one, even though they were 2 of the top vaccine producers in the world at the end of 2019. The other 2 being Merck Sharp and Dohme that didn't do anything almost on that one here, and Pfizer who came later. So, as I say, some people talk about industrial policy being risky, the state being unable to pick winners and all this. Here, it was a huge success. BARDA did pick winners. But as I said, they diversified. And interestingly, they even went for biotech companies. 3 out of the 6 were biotech companies. The other 3 were big pharma. But Johnson & Johnson and AstraZeneca were not specialized in vaccines before 2020. Now, colleague from Leuven, René Leveugelers, argues in a very nice paper that the world was quite lucky to have the mRNA technology available by 2020. After a long, difficult journey, Katia Carico, struggled for years and years before people got interested in that stuff, and now She's of course very famous, and really it's great. But so basically, it was done by the US, and I think it's a great example explaining how the Draghi report could be used concretely to improve things. Now, next slide. What are the lessons for Europe? Well, the EU, of course, the ecosystem, especially if you add to the EU, the UK and Switzerland, where, AstraZeneca, even though it's partly Swedish, it's headquartered in the UK, and Switzerland has Novartis and Roche. We have good research universities, we have good biotechs, we have big pharma companies, but we need more cooperation to emulate the NIH. The NIH has a lot of money. Let's hope Donald Trump will not destroy it, but it's very worrisome what he wants to do. But, we should try and emulate the pre-Trump 2.0 NIH. But of course, the problem is that the budgets remain national, and the Draghi report is saying you should move part of the budget to EU level, and he's right. Now, for BARDA, of course, there has been a health emergency response authority that has been set up by the EU. I think it's a good idea. Will it get enough money and enough good people? Let's see. And as I say, in case of an epidemic, they even call the army and all that. We don't have an EU army. Maybe thanks to Putin, we will have one at some point. But there would be a lot of things to do. But the main thing is, can we centralize more money at EU level and spend it a bit a la BARDA? So next slide. Now, one thing the EU did well, and I mentioned it yesterday too, and of course it's all linked to this fact that we need to optimize the trade-off between innovation and affordability. Right now, and it's true in the EU too, you've heard that rich countries get twice as many drugs available than poor countries. Well, who got the COVID vaccines first? Israel. Not because Israel was involved in the R&D or the production, but they paid more. So Pfizer said, okay, Pfizer-BioNTech, we will give priority to Israel. Now, Israel also allowed the companies to analyze in detail the impact of vaccination on their own population, so thereby contributing to the global knowledge. So I don't want to criticize them for paying more and getting it first, but okay, this coming back to this question, it was funded by BARDA, which is mainly US taxpayer money, and who gets it first? Israeli citizens. I'm not sure Trump was too happy about that. Now, thank God for them, the UK and the US benefited from close link to respectively AstraZeneca and Pfizer and Moderna to accelerate purchases. And in the EU, we had some coordination problem. At the beginning, 4 countries, Germany, France, Italy, and the Netherlands, said, okay, we'll join forces. We will discuss with these firms, and we'll get priority over the other countries. Thank God, Ursula von der Leyen managed everybody to say, look, the EU will take over and will centralize the purchase. And even that created some delay. The references are showing that it really allowed poor countries in the EU to get access almost as quickly as the richest countries. So next slide. On top of that, by having a single purchaser bargaining with the different companies, the prices obtained were low. By the way, they were meant to be, they're always meant to be secret, but thanks to our Belgian Secretary of State for Budget at the time, who tweeted the prices. We know what they were. And so I think it is good to centralize purchases at EU level to counter the strategies of the pharma companies to play countries against one another, which has been documented in an academic paper by Margaret Kyle, and George talked about that. And it also happened with the COVID vaccine. So I think I'm all for pharma companies making decent money because I don't want to stop them investing. At the same time, I don't want them to get indecent money, if I may say that, i.e., extra, really huge profits. So you want to keep a balance, and coordinating purchases would improve bargaining power on the buyer side as far as this trade-off between prices and speed of access is concerned. And it's even more true for, let's say, for example, orphan diseases where there is less urgency than with a pandemic where the whole economy can be in trouble just because, as Michel Kazatskin said yesterday, a health problem is not just a health problem, it's a problem for everything. So next slide. To conclude, almost within my time limits, the example of COVID vaccine innovation fully validates the conclusion of the Draghi report. BARDA, no, ARPA Health was excellent, and the whole US innovation ecosystem pre-Trump 2.0 is to be emulated. But it's a useful complement, not mentioned in the Draghi report, to have joint procurement innovation undertaken by the EU Commission, because we are in a world where we need to control public expenditures. They are under stress given the combined cost of aging, defense, and the digital and environmental transition. And I think then there is a final slide. Is there? Yes. More generally, the Draghi report rightly calls for more centralization in public R&D in pharma and in the organization of clinical trials, in particular for rare orphan diseases, where the EU is now lagging relative to the US. And there too, as we wrote in a little paper with Michel Goldman and Alain Fischer, a natural avenue to contain costs, which are really impressive, is to favor joint procurement, as happened for COVID vaccines. Thanks a lot.
Thank you, Mathias. It's amazing how much you said in, well, actually only 45 minutes. I am hoping that some of the students have questions, either to explain some concepts or go deeper on others, other conclusions and remarks and observations that you discussed. Georges, I invite you to also ask some questions. I was just, but yeah, okay. Georges, if you have a question, please don't.
No. Go ahead.
When I did some research last night, and I'm not sure whether you will have the answer, or I saw that HERA is not under I would say, the authority of the European Commissioner Varli from Hungary, but under another. Is this a good thing or a bad thing? Because for me, it was a surprise.
Okay, I must say, well, thank you for this information. I was not aware of it.
Yeah.
So it is a surprise for me too. Now, to tell the truth, and I'm not a politician, but of course, some people were surprised that the health commissioner was coming from Hungary, given that these days it is up to Mr. Orban to recommend commissioner. And this person whom I haven't met, and so I don't know his background at all. I only heard that he's a strong supporter of Mr. Orban. So then there are people who say, look, but in any case, it's not such a big job because a lot of health is still a national competence. Now, I don't like that because I would like health to become more and more a European competence, just like, fully agree with Draghi, we need to centralize more. Now, as I say, I don't know, I haven't heard speeches from that health commissioner, and who else then is in charge of
It's
HERA?
our former minister, no, state secretary of foreign affairs, Nadia Labib. She's in charge of HERA, I read.
You
So,
mean
and
the Belgian commissioner?
yes,
Hajar
yes,
Habib. Well, that's an opportunity maybe for us at I3H. So Hajar Habib, as people may or may not know, depending on whether they watch RTBF, the French-speaking public television channel. So she was anchor woman. She just, you know, performing the nightly news and all that. And then she became Minister of Foreign Affairs, and she's now commissioner for which job exactly? I'm not fully sure. Again, it was seen as not necessarily the biggest possible job in the commission, depending on competencies. But it's interesting if you're saying that she's in charge of HERA, we should meet her and we should discuss because indeed I think HERA is part of the solution. The good news about Europe is that, and I think it has to do with the fact that it is reasonably, many views are taken into account and so on. The bad news of that is that it's often too slow. The good news of that is that only things that make sense survive in a sense. And so I guess it would be interesting to see what she thinks and how we should try and make connections.
Well, if you want, Hilde, I can add maybe something
yeah,
on that.
yes.
For the Hungarian commissioner, it was not only this, but also all issues that had a gender dimension that were taken away. For example, issues of assisted pregnancies and all of that. So he's been trimmed down quite a lot. But generally speaking, this commission is very fragmented. What used to be one portfolio has been split, and you see that with the environment, you see that with health, but you see it with other things. And the other side is fragmentation, but also accumulation on some portfolios. For example, on competition, which used to be one single, very powerful service, very powerful commissioner. First, digital was added last time, and now you have the green transition. Now, what will that mean in terms of effectiveness? That I don't know. If you want to be optimistic, given that everything is fragmented or distributed, dispersed, and commissioners are politicians with egos and ambitions, if there is a conflict or there is a tension, it's the president who will decide. Which basically means that, in a sense, we end up with something more centralized decision-making. So we'll see. We'll see how it unfolds.
It is true that I've read, and I'm not at all an expert on this, but I've read that this was done on purpose by Ursula von der Leyen to have more power. Now,
I didn't say that.
Let's face it, she has had a number of good ideas, including on joint procurement for COVID vaccines. So
Yeah, yeah,
even though she got into trouble with some private phone calls or whatever with some companies, so but I think the overall picture, it was a success.
no, I
The
agree.
thing, and so um, but let's see.
Another question I have, unless the students, please, if you have a question, I urge you to raise your hand and ask the question through me or become a panelist yourself. Another question I had with the recent developments, yeah, with the European defense plans, and even our Minister of Defense visiting the Audi, the clothing Audi factory in Brussels, to transform it into a factory serving, well, defense, I would say, production for defense products, not arms, I heard, but not weapons. But would it be an idea to, because I introduced in the introduction, I said that indeed I read this week that Merck moved its factory to produce Gardasil to the US, which doesn't improve our competitive position, of course. Would it be an idea to invest in a European facility to produce vaccines for emergency response, or is that completely too far-fetched? And
Well, if I'm happy to, I do think that the Draghi report in general, so the Draghi report is calling for more European resources. Now, where they have to come from, he leaves that open. Should it be grants coming from the different member states, and what is the interaction with deficit rules and the like. I do think that I agree with you that the unlocking of these fiscal rules for defense could be an opportunity. I can see that a lot of people in various countries, especially the so-called Northern European countries that are more restrictive in terms of deficits and the like, they would say, let's not open the Pandora's box. On the other hand, on some specific key infrastructure of joint interest, I think it could be, I think it's doable. And indeed saying, look, for some things that are clearly useful and, the earlier, I mean, I enjoyed both talks and your introduction, by the way, Hilda. But this idea of, we want these antibiotics on the shelf. We don't want to use them too often because we know that they are in a sense addictive because they are to the body, not to the that somehow the more you consume them, the more you need them and the less efficient they are and so on. So this idea of saying, look, let's have some European wide infrastructure to produce them, to be ready, to have some on the shelf and all this, and let's fund this by EU money. I think if it's not hugely expensive, and I think it would not be hugely expensive, I think that might fly. I think it's a good idea. Well, if I've understood correctly what you were saying, huh?
yes, indeed.
So
We have a question from Anja. Yesterday it was touched on the point of cross-border clinical trials. How will this work when it comes to language barriers, but also health insurance and patient compensation?
well, personally, I don't have much expertise in this. I think I'm sure some people have thought about this, how to organize, multilingual clinical trials. Even in a small country like Belgium, we have this issue. I guess things are becoming much less complicated these days when you can basically say, okay, we don't speak our relevant languages, but then let's bring a phone that will translate immediately, and there we go. Then there are, of course, different regulation, all these kind of things. My guess is that especially for rare diseases, it's already partly taken care of by pharma companies. On the other hand, I'm sure they have ideas about we should ask them what are the obstacles and how to live them. But I think it's a good question.
Yes, absolutely. Well, I think it's indeed partly organized already by pharma companies, but definitely university hospitals organized in European reference networks, where they indeed definitely for rare diseases combine data and rare disease patient registries. With respect to the language barriers, this is really indeed, Anja, a huge difficulty because even though indeed we have tools and software to translate, I would say, an English written protocol, the language for patients is really, really crucial. They need to understand, as you know, Amja, I'm sure you know, they need to understand the whole informed consent. They need to understand what they sign up for. So this is indeed, as you rightfully ask, a huge, huge, huge issue in Europe, and indeed, as you say, much as in Belgium, it's with our three languages. I see Ivana, you are here.
Yes.
Hi.
Thank you very much. Do you guys hear me?
Yes, we hear you,
Yes.
Ivana.
Well, first of all, thank you very much for the very inspiring talks this morning and for the organization of yesterday. I think for us young researcher, it's an open world that is getting more and more interesting. So that's where my question is based on. So how do you think you both as experts, how can Europe get a leading role in healthcare considering the current geopolitical changes? And my second question is, how can we as young researchers can contribute on a short-term period? Because we can learn from the leaders, we can learn from the key opinion leaders, but then you will probably get some results within 10, 15 years from us. But how can we contribute on a short-term period?
You ask the right questions to the right people, Ivana, since both Mathias and Georges are policy advisors. So go ahead, share your thoughts.
Georges, you start.
You mean, is your question as, in terms of what kind of policy areas you should think of and to develop ideas and proposals? Is that the question you had in mind, Ivana?
Well, I think in considering the first question about how can Europe have a leading role in healthcare, I think there are different aspects that are part of answering this question. One of them would be policy, but I think to come up to a policy, you need other blocks to be built to come up with the right policy on a short-term period. So I'm not sure how far are we in Europe to get a leading role within now and 5 years. Is that even possible?
I would say, something that was mentioned yesterday already. I mean, there's diversity. There's path dependence, as we say. Some things are in different places in Europe, and I don't think either politically or practically it would be possible to rearrange parts of the puzzle. I think that all the issues which, let's put it that way, let's try to transform diversity or fragmentation into a source of strength, because centralization has many advantages, but the good thing about fragmentation is that you experiment with different things, that you can see, certain things that work better than others. So I think any initiative that tries to exploit, in a positive sense, this fragmentation, this diversity, and at the same time, try to centralize when possible. Data is one example, but clinical trials were mentioned a second ago. When I was your age, Norway was a leading country for clinical trials. And then it was Germany. A few years ago, I heard about Germany being, and now I found out that it's Spain. Spain is apparently an ideal space for clinical trials. Now, what is it that drove that transfer, and why are the Spanish so good now? They managed to displace the Germans. Let's try to learn from that. On the another area which is kind of in the background of Jorge's presentation this morning, and and what Hilde said, it's almost anathema. But why are we so reluctant to have publicly owned manufacturers of some critical products? And this is an area where the Americans will not go. They will not go. The Chinese, that's their business model. But why not go start exploring? 50 years ago, publicly owned companies, most of the economy, banks, energy, everything was publicly owned, telecoms. Now we went in the other direction. But I think that there are many areas where public ownership would make an awful lot of sense. I mean, for antibiotics, to me, it's crystal clear. And there wouldn't be any problem with the European state aid control. That would be considered to be compatible aid. Sorry, I've talked too much. Mathias, I don't know if you want to add
something to that.
Sorry?
Can I add something to
Definitely. Please do.
To Ivana? Ivana, I also think that what is needed for a change is really looking at the evidence. What type of policies and what mix, definitely the mix and the combined effect of different policies has an effect, a true effect on turning an invention into a true innovation, not just indeed the Me Too's that come out, but disruptive, really breakthrough innovation where others can learn and build from. And that is something we do, as I told you, or as I explained yesterday, very briefly, and this morning a little bit. This is something we do in the Horizon IP project. So it's European money, great. The difficulty is in our work package, and I would say Thierry and Sisyan, both I3H PhD researchers, they invested more than a year and a half to entangle and clean up and extract data, super expensive data, to just come to being able to measure, and then looking at what policies came up in what year, in what country. But the data was so expensive, and I would say if we need and if we want to measure this effect, I would say Europe needs to put much more pressure, US of course too, but Europe for sure, on making data publicly available, or at least more transparent and usable for researchers, instead of us putting all the money we got through that project in buying that data. It's outrageous, and I'm very, very upset about it. But this is measuring the effect, and the combined effect of policies is, I think, what is needed to then reform and look into what do we do, or what do we need more. And definitely, as Josh this morning told us, looking at how we can invest more in incentivizing drug repurposing, because there's a huge world out there that we already know, where there's already so much invested. Also, failed trial data. Why not make this more publicly available? We can learn so much from it. We can avoid duplication. This is really what I think is needed to make sure we incentivize the right things for the right stakeholder. Voilà. Okay, Mathias, sorry.
No, I think I fully agree with what you said. I think it's an interesting question. My only question I would have for Ivana is what is your profile and in what capacity do you work or do you plan to work? Because I think yeah, all profiles can be helpful. Because when you say as a young researcher, what should I do? Well, it depends a bit on what you want to, because this is a very interdisciplinary program. So where one advantage is that you guys are very heterogeneous in terms of where you come from and what you want to do. And so that was a bit my question.
Well, thank you for the question. I'm a PhD student in oncology, but I have experience working for the WHO in Lyon at IARC. And I've seen the difference in being on the top of the healthcare system worldwide and the impact that you might have, or being within a university hospital or in the university where you try to have an impact on regional level. Those are two different things. I think one of the major learning processes that I've obtained in the last couple of years is that you learn from each other in an interdisciplinary approach, but most of them, I gained a lot of frustration about the waste of research, funding, research, details, results. As mentioned earlier, 85% of the budget has been wasted and will never reach a patient, or clinical trial phase 2 or 3 or 4 will never get a success. And I think there is so much to gain from it, because if we stay within our own niche, within our own bubble, we will never get better and we'll move forward. So I think working together from different disciplines might provide us with even more insights to apply for bigger budgets, but effectively to apply for better results that in this case will reach the patient in a very, very short period of time. So I can partially answer your question because I do not know what I want to proceed after a PhD, but I have a lot of different ideas and I'm here to learn and to get, I think, even more questions based on your lectures and your experience. But I hope that we as young researchers can have a better and a bigger impact in a short period of time than within now and 10 or 20 years.
Yeah, I mean, I think first of all, I applaud your your thoughts. One caveat though, the failure is okay. Huh? Waste at some level, waste is okay. I mean, there is this line, if everything I do works, then it means I'm not taking enough risks. Huh? And by the way, there is evidence that unfortunately, that there is an impressive paper by Andrew Lowe and his team saying that it's the safe innovation, the Me Too drugs that make the most money in the US. So they exploited this clever idea that you can get access to a fast track at the FDA if you're doing something really risky and innovative. And unfortunately, the fast track is much less profitable than the slow track. And so in that sense, some people are saying, look, we need to take more risk and let's not call it. Okay, exposed is unfortunate. If you fail, that means that there has been a waste in a sense. But you have to look at it, look at the overall picture in terms of. So one element is the percentage of success, and the other element is the size of the success. So in that sense, we have to be a bit pragmatic.
Thank you. That's
Thank
very
you so
interesting.
much, Mathias, George, and thank you, Ivana, for your enthusiasm. Indeed, it's inspiring for us to have such students. And I would say the world is your oyster. After this program, you can do whatever you want. We are here to support you and see wherever you want to go. We will try to help you at least. We need people like you to become tomorrow's leaders. It's clear we need other leaders. Well, I'm talking about the man I talk about. Thank you so much for this very inspiring morning session. I learned again so much. I need to digest a little. For those who stayed online until now, we went 15 minutes over time. My apologies. But we come back at 2 to discuss some innovation technologies. Thank you so much. Have a nice lunch.
Thank you. Bye-bye.
Bye.
Thank you.
Bye.
Bye-bye.
Thank you, Mathias.